What we know about children's mental health is that it is increasing year on year. In 2017 we got some data from the government that told us that around 1 in 10 children in primary school, 1 in 6 children in young adulthood and 1 in 7 children in secondary school would be suffering from an emotional or mental health need at any point in 1 year. But what we know is that since the pandemic, the mental health of our children has been impacted significantly. Many children have struggled at home during periods of lockdown. Many children have struggled in going back to school after not being in school for large amounts of time. And parents have struggled to know what to do really. And we know that over the last year, the referrals to our mental health service have almost doubled, so 95% increase in 1 year. So we know that we can't meet the demand, I guess, of all the children that have emotional mental health needs by a clinic, hospital-based appointment. But what's really important to me is that we don't just provide services that are based in hospital environments, and that we listen to children and young people and provide services that meet their needs where they are, as close to home as possible. So what we do in Rochdale is we look at our money for children's mental health and we spread that across a number of different organisations. What's really important is that as a parent, you know where to get help for your child. So most parents would rather help their own child than go to a professional to get that help. But we need to make sure that you get the right information and the right education and the right sources of information so that you can help your child in the most meaningful way. So the first thing that we're doing is making sure our information is easy to understand, it's easy to access, and that it's meaningful to you. The second thing that we're trying to do is make sure that you don't have to go around the houses to get support. So what we do is we have a single point of access, which is a phone line that parents and professionals can ring if they're struggling in gaining support for their child. And that single point of access will signpost you to the most appropriate services, whether that be in your neighbourhood, whether that be at Rochdale, whether that be children's mental health or even school. What we're also doing is making sure that our schools in Rochdale are skilled and up enough to be able to support children with mental health presenting conditions. Now, mental health can vary. Sometimes children will have anxiety or low mood, and that doesn't necessarily mean they have a mental health problem. What that means is that they're struggling at that moment in time, and with the right bit of advice or support, they can get back on track. So we have new mental health support teams in schools. They are in 38 schools across the borough. We have also working with schools on something called a whole school approach to make sure that teachers can access training, support and information to be able to care for children who are going to school. Because we know that children want to speak to the professional that's closest to them, and that again isn't always a doctor or a nurse.
My role within the schools is to consult with mental health lead in each school. Young people will be identified that might require some support, some extra help, but also might just need signposting to relevant services. So that might be the wanting to get out of the house more and engage in activities that will benefit the well-being. It might be that there's some one-to-one support offer, so if there's a young person that might be excessively worrying about, say, maybe the change to high school or the change upcoming exams or SATs, that we can do a piece of work around that to make those difficulties a little bit easier and a little bit more manageable, really. In addition to that sort of one-to-one work with a young person, we might also look at some group work if there's a specific need within each school. And that might be, again, working on anxiety, it might be working on managing low mood, it might be looking at ways to control emotions and to make those choices around when we're feeling big emotions a little bit more appropriate and a little bit more useful, really, and making better choices. Generally, we're quite guided by the schools in terms of what they want, in terms of what they feel they need.
When we originally got involved with the mental health support team in Rochdale, it was a really exciting opportunity for us. At Broadfield School, we've always had social and emotional mental health at the heart of what we do. We are a very diverse school. We have lots of different children from lots of different backgrounds, and supporting children in their emotional well-being is something we've always been really passionate about. But when this new exciting opportunity came along to be involved, it really allowed us to look at our strengths as a school, but also challenges that we were facing. And coming on board with the mental health support team, accessing their training, liaising with the professionals involved, has really allowed us to come up with a systematic approach, very similar to the graduated response to supporting children with special educational needs. So as teachers, we know that for children to be successful in their learning, we need to make sure that their basic needs are met, so that they have safe accommodation, they are well fed, but also that their social and emotional needs are met. So what it's allowed us to do is really highlight the need for appropriate and timely mental health support for children. And our teachers and our teaching assistants, our whole school staff are aware now of what to look out for if a child is displaying any concerns.
Or even if it's just about a young person that wants to understand what's out there in their local area, so liaising with other services about what's the most appropriate support for them, which might be getting them into extracurricular activities like playing football, arts, crafts, drama, sports generally, anything that they want, and we might try to help support them to improve their own well-being in a really sort of sustainable and functional way.
We look at social prescribing, so we set up any activities that young people might be interested in to help with their mental well-being. So we run various sessions, from sporting to creative sessions, every week. Currently we've got 8 sessions going weekly. These include multi-sports, arts, gardening, dance and swimming. So young people can use our service through Thrive. They can opt in to the activity side. We create a personalised action plan which looks at what they're interested in. Have they tried it before? Is it something they've always wanted to do? And we build on that with them. We also work with Mentally Healthy Schools team. We go into schools delivering a 6-week programme focusing on mindful movement. This includes activities such as sensory activities, breathing techniques, yoga and other calming behaviours.
Through #Thrive, I was able to access Link for Life, which is now known as Your Trust, to help with fitness. When I was there, we did swimming, I did some running on treadmills, and there was also some badminton and running options in group sessions, and these really helped with my mental health.
So we work one-to-one with young people aged 16 to 25. We work on things like anger, anxiety, low mood, substance use or alcohol if you have problems with that as well. We deliver person-centred care, which means that our care for our young people is always centred around them. So they are at the centre of everything that we do. We will do things like independence skills, and we'll help you get a bit more independent and less isolated, but then we can also do targeted interventions for mental health as well. We do a Closing the Gap group, which runs every Wednesday at 4 p.m. We are running from September to December, and our new group will start in January. That is again picked, what we talk about is picked by the young people. They have chosen to work on things like drug and alcohol education, current issues such as Black Lives Matter and feminism, and money and budgeting. We are also trained in mindfulness, which means I'm an accredited Mindfulness Now teacher, which means that I'm able to offer quite a more formal programme of mindfulness for reduce of stress, reduce of anxiety, increase in mood. We also offer auricular acupuncture for young people, which is where we place little pins in their ear at certain points and it connects to the meridian lines in their body. This is proven to reduce stress, reduce anxiety, improve mood, improve sleep and reduce cravings for alcohol or drugs if you are trying to reduce or abstain.
As the mental health lead teacher, I was able to access training through the Anna Freud Foundation, and what that did was it upskilled me in being able to coordinate a whole school approach. And with the support of the staff from the mental health support team, I've been able to look at our existing practices in school, but also come up with a specific pathway. So if a child does, have a change in behaviour that is noticeable, we very much follow our well-established safeguarding procedures. But this new method and this new way of actually looking at a child's SEMH needs specifically allows us to decide, right, what is the appropriate level of support. So if a teacher or a TA or a parent feels that they've noticed any particular concerns, such as increasing levels of anxiety, a change in mood, something may have happened within the child's life, the first thing we do before anything is to actually speak to the child, and we allow their most familiar adult within school to do that, to actually talk to them, actually see what's changed, is there anything you'd like to share. Secondly, after that child chat, we, if appropriate, engage with the parent. Has anything changed within that child's life? Has there been a significant life event? And how does the parent feel about that? What we then do is we look at, is there any existing support within school that child can access? If so, that will happen. But if not, and we need that more specialist advice, that's when we would liaise with our young person's mental health practitioner. And it's really great because we have that professional in school 1 day a week, and they are contactable all the time. So it means that if we have any questions or queries, we can always get in touch with them. And then we have the opportunity to talk through that child, their needs, their concerns, their challenges. And then it's at that point where the most appropriate level of support gets decided. So it might be to work with the mental health practitioner for a period of, say, 6 weeks on that specific symptom, such as anxiety or low mood, or it might mean that there is more of a need there, we need to explore something further, in which case that's when we'd access the other services within the Rochdale Borough through the single point of access service.
Our job is for any referrals that come in to CAMS, they come in through our desk, and then we what we call triage them. So we look through them, look at what's the most timely place we can send that referral, and look at risk and try to understand if other services rather than CAMS would be the most appropriate service. So after we've triaged initially and we've looked at the risk and where we feel the young person would be best suited, we would then refer that on. So it may be CAMS, it may be Thrive, it could be one of the voluntary organisations we work with. It might even be talking to school again and explaining that early help and family support might be the best thing initially at this point in time. There's somebody on duty every day, so both professionals, and that is teachers, social workers, midwives, anybody really who works with young people can ring in for advice. As well as that, parents can ring in at any time to get just general advice, or also to find out where the young person is within the system of CAMS itself. We have 4 locality mental health practitioners. Their job is to conduct assessments, generally over the phone, and looking at the whole family, obviously with the young person in the middle, to make sure that the young person gets the right service, but we can also give the support to the family. We work very closely with the Early Help and Safeguarding Hub. So again, we cross-pollinate information so that everybody gets an understanding of what's happening, so that we can make sure that all services that are needed can be involved.
So #Thrive is a service which is to support low-level emotional mental health needs. Now, when you go to #Thrive, again, you will always see a doctor or a nurse. You will meet somebody who will understand your needs, and they will signpost you or direct you to the right service for you. Now, sometimes that's something really fun like gardening, or sometimes it's circus skills, or sometimes you do need to speak to someone like a counsellor to get more support. But it will vary, and just because you're not speaking again to a doctor or a nurse doesn't mean you're not getting help with your emotional health needs, because you can get that in a number of ways. And when I've worked with children in the past, they've told me that actually it's sometimes the most simple things, like having an adult that you can talk to or doing something fun, that makes life so much better.
#Thrive! Sometimes we have big feelings that seem hard to cope with. Places like #Thrive can help you.
#Thrive is a free service available to children up to the age of 19.
You can just turn up. Hi, I have a problem. I heard you can help.
We certainly can. You want to take a seat and we'll take some details?
Yes. You could be referred by your school. Hi, I'm sorry. I was sent for an appointment from my school, if that's okay.
Of course it is. It's not a problem at all. Welcome.
Thank you.
Do you want to take a seat and we'll take some details?
Right.
Good afternoon, we've come for our first appointment with Mandy.
Welcome. Yeah, no worries. If you want to take a seat, we'll take some details and get you through.
Thank you.
We'll let her know you're here.
Thank you.
Parents and carers can also refer you to #Thrive.
At #Thrive, they do lots of fun things that can help. Thrive is really good to help because you are talking to a small group of people who was around your age, so talking to those who are around your age is a really good way to cope.
Sometimes we can do one-to-one sessions if feeling scared in a bigger group, and it can feel better doing it with someone you don't know as much.
Before I came to my first session, I was nervous because I thought I'd have to explain everything that I was feeling in one session. However, when I got there, they allowed me to take it at my own pace, and it felt more like a conversation and not an interrogation.
That has helped me with my emotions, anxiety and feelings because they'll always have the right answer, and they also help me with my anger issues.
Thrive has helped me with my breathing process and helped me control all my emotions so that I don't get overwhelmed.
And you think, actually, no, I don't have to end my life. And then you think, like, maybe I can solve this. And you talk to people and, like, you have, like, counselling and stuff. And then it sometimes goes away.
Thrive has helped me by helping me to develop coping mechanisms for my social anxiety and has helped me feel way more confident in my own skin.
If you think you need some help, come along.
Sometimes children do need to see a specialist service, and that's where you will be directed maybe to another clinic appointment or to a different voluntary sector organisation. So you might get a referral to CAMS and they will talk to you about a specific need that you have with regards to mental health. Or you might need an assessment for something like ADHD or autism, and you might need specialist people to help you do that. We also have specialist services in Rochdale for children that might be not wanting to access mainstream services but do have a specific need. Now these might be things like struggling in going through to young adulthood, or a drug and alcohol need, for example, and that's when you will need a specialist service.
Hello, my name's Zahida. Welcome to Rochdale CAMS. If you have been seen by the Mentally Healthy Schools team or #Thrive, been assessed by them, and if at any point both teams feel that they can't manage your symptoms, they will refer on to us at Rochdale CAMS. So in Rochdale CAMS we have teams of nurses, psychologists, psychiatrists, speech and language therapists, occupational therapists, social workers and therapy assistants. We offer specialist services to children and young people who experience mental health difficulties. Some of these difficulties can include anxiety, depression, self-harm, psychosis, eating disorders and more complex psychological difficulties, and we also do autism and ADHD assessments as well. If you are referred to Rochdale CAMS and you receive an appointment and you're a bit nervous, a bit apprehensive, a bit scared, don't worry. We're a lovely team here And when you come for your appointment, although on the appointment letter it might say 1 hour or something like that, we have lots of time for you.
So I really hope that this film helps you understand about our services in Rochdale. And what I'd really like to say is that if I was a parent in your shoes or I was a child in your shoes, just ask for help. There's lots of people out there in school or a worker that you might be working with who know what we've got on offer. But most importantly, there is a single point of access. We have one front door and the number will be shared with you at the end of this film. So if you are struggling, don't suffer in silence, ask for help because we're here to help. Thank you.